Hi, this is Ryan. The case I'm going to present is a cervical case of a lady I've been seeing here. She's 58, basically a homemaker, but does have a daughter that has seizure disorders, so she does have to care for her and drive her and that kind of thing. She's had onset since May 2012 for mainly neck pain, but she does have dizziness that she complains about. As you can see there, she tries to say that it doesn't bother her, but she still thought it was bad enough to come get checked out. She primarily just has that neck pain with the dizziness, hasn't complained of it going down into her shoulders or thoracic area too much or low back at all. Some of the ideas in that thoracic or cervical area that's been bothering her is the facet joints in there. She did have an X-ray slash MRI from previous providers that just showed some arthritis. She does have some TMJ type possible referral. Also get the erector spinae back there, the traps kind of covering up. And then other things to think is that vestibular system or just maybe a vascularization issue there. She So that leads me to the hypothesis of the facet, probably primarily since it is kind of movement activity brought on for the most part. The erector spinae and trap probably have tightened down at this point due to the pain at the joint, and the vestibular system is still possible from where I'm at. So things that seem to aggravate her, as she talked about, is looking down, the sitting for a while, or doing increased activity stuff. Things that have kind of helped was heat. She did talk about meds maybe for a little bit, but she doesn't like to take them, so she avoids. With the dizziness, she couldn't identify anything that really set her off. And really on either one of these, she didn't really have like a timing factor on irritability to get a good idea, how long does it take to come on, how long to go away, any of that. Her history, no major change really during the 24 other than activity based. She, as we said, May 2012 is where she started to notice this, and it's kind of got worse since that time, but more recently is kind of leveled off. Uh, no real mechanism of injury that she can recall since current episode already kind of said that. It did start more with the neck pain though, then she does get kind of that scapular pain that seems related, and then dizziness, which is unexplained for the most part of this. She does get occasional headaches that does seem related. Denies any other general health or surgeries that seem like it would add to that. She did get a corticosteroid shot in November 2012, but without much relief. The red flags on here, really not too many other than this dizziness that's still kind of unexplained and nothing. She doesn't talk about the room spinning or anything like that, that it's just kind of a general dizziness. Yellow flags, it's just more that idea that stay-at-home mother, her husband has been out of town for a year plus taking care of his family, and she's kind of that lonely, stay-at-home, no activities outside of the home type of thing that and with her symptoms stress related, that would be more the yellow flag, but she didn't mark anything with depression or those kind of things. Special questions that she had previously had some pretty extensive vestibular testing that all showed negative. Talked about the imaging, getting a little arthritis in the C-spine at this point, and medication, she is on Celebrex as kind of general to help with that. Asterisk signs, the looking down, the sitting, so kind of those subjective reports of the frequency and severity that go along with the pain, and then also the dizziness. If we can try and narrow that down where she's paying attention to it a little more. I'm still thinking at this point with talking to her that the facet dysfunction is leading with the rector spinae having kind of tightened down from that. Possibly some TMJ stuff because that kind of comes out as I ask her questions here a little more, that she does feel a popping in there and that does bother her. So I can't really rule out my musculoskeletal at this point. With that vestibular testing, I'm more prone away from that vestibular system in the issue. So the severity here, I put it as moderate just because she kind of describes it as a constant pain, average 4 out of 10. She is able to perform her ADLs, just not quite with the freedom desired and without any of the pain showing up. Her irritability, again, hard to say, but since she didn't really recall it exactly, I put it as minimum. And seems to resolve with kind of applying heat, stopping activity, at least getting it to a level that she could tolerate. Primary nature still at this point, I'm thinking musculoskeletal due to some of the other testing she's already had. And the stage, I'd put her basically at the chronic at this point since she's been from, May to January here. Current stability of the disorder is more or less stable at this point. Again, it does fluctuate throughout, but hasn't really went above or below and changed much of recent. Uh, Top three hypotheses to rule in. So I'm looking definitely at cervical range of motion with the overpressure, see if some, one facet or one level pops out a little more than the others. We can go with the palpation, kind of checking that erector spinae and those accessory motions of the cervical joints, looking at the OA, that kind of thing. What items would I defer? The TMJ type stuff I might defer at this point because that may be due to the referral / we kind of address it at the same time. The vestibular and cranial nerve, because I'm not really thinking that because there are other testing, but you never know with patients' reports. Sometimes that may still be called to come back and look at if nothing else is jumping out. Contraindications or precautions, I really don't have any other than maybe thinking that vascularization to test kind of vertebral artery along with that dizziness. I do notice she does have forward head, rounded shoulders, so that's something to talk about and address. And the functional movement analysis, that forward flexion was probably the primary thing that set her off. The accessory motion stuff also did with closing on the right. She didn't have any problems thoracic or shoulder that seemed to jump out still, so I think it's pretty localized to the neck at this point. So it didn't really, she didn't talk about any radicular symptoms, so I didn't have much reason to do the neuro exam except possibly the cranial nerve that I was putting off at this point. So range of motion as you see it there, limited, pretty much all directions, I would say. The way she describes some of it is that tightness of kind of the erector spinae and then that closing of the joint on the rector spinae. Most of it, especially on this right side, seemed to create kind of some of the pain she's been used to feeling. As you ease it, you could ease it with some stretching and some of the mobilization at the C spine. Really seems pretty local to that C4 level though, that when you press on there and try and close that right C4, she jumps, kind of grabs you type of thing, so it's pretty localized at this point. So I'm still liking the facet dysfunction. The muscle testing that's looking at arms at all or shoulders or back, that it does bother her with trying to close down at all, but not from muscular nature. I just think that's a result of the joint bothering her. Now the muscles have tightened up. She does have, again, the tight muscles, so the extensors, the flexors, the traps. Giving her that four-way neck thing sounds like a good idea at this point. Motor control, she does kind of have a poor motor control of her C-spine. So if I have her look kind of directions and have her bring her head back to vertical without anything she can align from, eyes closed type of deal, she kind of does keep it tilted to the right side a little more, or excuse me, the left side a little more, because she doesn't like to close on that right. So I don't know if that's part of the things that we need to work on and why she's getting maybe that dizziness, just that disconnect of where she thinks things are and where they actually are. The special testing things like Sperling's didn't really seem to bother her. Again, she didn't have the radicular symptoms, so it's not totally surprised. She did like the distraction a little, which opens things up. So primary hypothesis I'm still stuck on that facet dysfunction. Closing on the right at this point has really jumped out, especially that C4 level. Soft tissue, I still kind of think that comes secondary to the facet, that she's still going to make gains by doing that. The asterisk from the historical is still that way she describes problems with activities of the sitting. The physical exam, the forward flexion / extension and closing on the right are definitely the ones to keep monitoring. I think she can get a pretty good recovery from this after we get her moving on the right things to get that right side to close and get her tolerating that activity again, get her kind of loosened up in the C-spine so that she can tolerate the movements as well. I'm looking at about twice a week, 6 weeks. I think she'll have to continue on the home program for a few weeks after that. So ideally, in that 8 to 12 week range, she should be feeling pretty good. Uh, Goals would be that she could do ADLs getting down below 2 out of 10 from doing them, that they don't totally aggravate her like they kind of seem to right now. I would also like her independent in that self program within about 6 weeks here. Ready for discharge when I feel comfortable she has the home exercise program and kind of how to use it to control her symptoms, and when she kind of has that report through things like photo where she's shown the improvements she's looking for and happy with the results. Uh, if she's not making progress, then I would kind of look at, have I really tried all the different parts of exercise options to move, close, turn the neck, loosen things up, things like dry needling, possibly that kind of deal. And if she's really not getting any better, not having any good days in there, that type of thing, then that's where we gotta maybe think about talking to somebody else, or that we're still not helping her out. Uh, so management strategy is that cervical, loosen up the neck, get those joints moving in there, and then let's strengthen things so it gets that coordination and motion back. And I would leave it open for any questions at this time.